Okay. So to get started, I'm just going to outline the presentation. So we're going to start by giving a snapshot of the context in Lebanon and move on to sort of frame the urban context in general. We're going to focus on the protection monitoring and information dissemination project that was initiated in August of 2013 by the IRC in partnership with UNHCR. And we want to focus on the use of ICT in that project in order to improve the delivery of protection and assistance. We're going to focus on both the successes of that as well as the challenges and limitations and discuss some of the lessons learned. And Jad will focus then on some of the innovations that are in process on the back of those lessons. So we would really like this to be open to discussion. I know we've got a lot of people in the audience who have ICT knowledge. Many people have joined us from Lebanon. So we will pause throughout the presentation to allow questions. And then we'll try to keep the presentation to approximately 30 minutes so we can have a vivid Q&A and a debate at the end. So I'm going to hand over to Jack now to get us started.
Okay, hi again. I'm going to start by giving you a snapshot of Lebanon, showing you where the refugees are in Lebanon. I'm going to share my desktop with you. And I'm going to do a presentation on Google Earth. Okay, first I will start by showing you how small Lebanon is. So Lebanon is a country just 10,000 square kilometers. Before the crisis and before the refugees, Syrian refugees started coming 3 years ago to Lebanon, we had 4 million, the local population was of 4 million. Now, 3 years after, we had an additional 1.1 million refugees. Those are only the ones registered. We have as well an additional number of unregistered refugees. On the map, each and every dot that you see is a village. Most of these villages and cities in Lebanon, these are urban areas. So as you can see, all over the country, you have the refugee population that is now living among the local resident population. For example, I'm going to zoom into one of these areas. Okay, the size of the bubble is showing the size of the population. This is one of the villages in Lebanon. It's called Saad Nail. Inside Saad Nail, we have almost 15,000 registered refugees. Of course, they're not all in this point in a camp. They're, if you can see on the map, they are living in the buildings among the resident population. So they are invisible to us. Except for the ones who are living in spontaneous shelters. Okay, so I'm just going to show you here. These are, each dot is a spontaneous camp. Spontaneous, it's not a managed camp. It's a camp that the refugees came and they settle up some tents there and started living. So if you can see in the country, these are the visible refugees that we can see that they set up a camp and they're living there. And each one of these is an actual, it's a small camp, lots of makeshift shelters. This is, as you can see in this image, this is what the ITS looks like. This one in particular, it has 336 persons. But these are only 16% of all the refugee population in Lebanon. So 84% are invisible. They're living in buildings, in houses, apartments, garages in Lebanon. Okay, I'm going back to the presentation. These are the types of accommodation that you see in Lebanon. We have the 16%. is the one that you just showed, the ones living in informal settlement. 57% are in apartment houses, and the others are living in unfinished buildings, garages, one-room structures, inside workshops, and only 3% in collective shelters. This is a picture that you saw a little bit bigger of one shelter. As you can see, these are like made by the refugees themselves, most of them. Some of them they have like tents, the regular family tents, and others, but most of these spontaneous settlements look like this. This is an example of an unfinished building. As you can see, some apartments in this building are almost done, and they have windows and doors, but most of the others they don't have, and they have, in each one of them you have several refugee families living. In a building like that, you could have up to 300 persons living inside of them. So I'm just giving you a brief introduction about the situation quickly in Lebanon of the refugees, and I go back now to Julia to tell us a little bit more about the urban context.
Thanks, Chad. So I think actually, starting with a picture of Lebanon is excellent, because Lebanon really highlights the specificities of the off-camp or the urban context. So in this presentation, when we say urban, we are referring not just to the urban built-up areas, but also peri-urban and rural areas. So in the Syria response, in this region, it's estimated that approximately 85% of refugees are living outside of the camp. So in contrast to the camp setting, the urban environment poses unique challenges to the provision of protection and support. And so one of these challenges, this is highlighted, I think, very well in the map that Jad showed you, is that the population is scattered. They're not highly visible. So locating persons of concern and reaching them with information is a tremendous challenge. So in camp settings, communication tends to be more streamlined. Mass information can be carried out, bulletin boards can be used, house-to-house information dissemination. And of course, this is not the case in Lebanon. So beyond locating the population, we need to understand the local needs and dynamics. So how is information received in the urban environment? What networks are in place? And what are the information needs of the host community? Because, of course, the refugee population is living amongst the host community population. Service provision, accessing services in the urban environment is also a challenge. Unlike in a camp setting, refugees are relying on existing service networks and service providers. Whether they're governmental, NGO, private, they may face unique barriers in accessing these services, so discrimination, the cost, or the capacity of local service providers. So we mentioned again that the population is dispersed. So identifying their needs and assessing their protection needs is also a significant challenge. So we need to look at ways that we can reach refugees where they live. So Jad moved on to talk about, to the slide for some protection concerns that are in Lebanon. So with the concerns in the general urban environment, they all apply in this context. Limited mobility is a significant problem in Lebanon. So there's a limited legal status for refugees in this context. This means that when they enter Lebanon, they're given what's essentially a tourist visa. So when that residency expires, they no longer have legal status to reside in the country. So this means they can be apprehended at checkpoints, detained. They're vulnerable to exploitation and abuse. So this is a significant restriction on mobility. Also, resources are dwindling, in particular in protracted displacement situations. So transportation costs are prohibitive. So in general, in Lebanon, we found that access to information is a significant problem. Refugees don't know where to go. They don't know who to speak to. They don't know how to access services. In addition to not knowing about services and not knowing about rights.
Yeah, exactly. Like access to information is a is an issue here, because it's not like if you compare a regular camp situation, you have all the refugees in one place. You can put up a speaker, pass on a message. You can meet and call for a meeting with some refugee leaders, and they all come, and then you pass on a message. You can put billboards in specific places visible to everyone who's passing by there. So it's easy to pass on the message. But when you have such a scattered population, living within the population, like really in the same buildings around, it's much harder to target this population. And at the same time, it's very hard to deliver services to this population. Julia will tell us a bit about the protection monitoring project, which is an IRC UNHCR project.
Yeah.
Please, Julia.
Thanks, Jack. So in order to address some of the concerns that we talked about with access to information and connecting refugees and other persons of concern to services, UNHCR, in partnership with the IRC launched the Protection Monitoring and Information Dissemination Project in August 2013. And then finally, advocacy is the other key component. So in this context, we introduced a few pieces of technology to try to improve and be able to better reach refugees where they live. So firstly is mobile data collection.
Okay. Okay, for mobile data collection, let's look at how we used to do things before. We used to send teams to the field with paper forms. These paper forms or assessments are filled regardless of what they were, if it was a monitoring report or a needs assessment. It was being filled on the paper, taken back to the office, and we have a data entry team. The data entry team goes in, fill in this report, fill in this data entry, and then it becomes accessible to others. So this process has a lot of errors, from reading properly the handwriting, the errors upon data entry, and the delay in getting access to the data to be analyzed or to be used for your work. So today, not only in Lebanon, in many parts of the world, we've moved to mobile data collection, whether through mobile phones or tablets. So we're using mostly, most of them are ODK based. So for the technical people who are working in this field, they will know what ODK is. For the others, it's Open Data Kit. It's an open source software. It's an open source tool which you design your form in a very simple way on Excel, and then you publish it on a server, and it becomes a form on a mobile. And at the same time, you can have a web interface for that form to record and put the data. So in this protection monitoring, we are sending the teams with this ODK form to the field, and they're collecting protection monitoring information. At the same time, they can send it straight away from their phone. It goes back to the server, and then it becomes accessible for the protection team to analyze this data, to monitor hotspots or conflict zones in the country. So some of these tools are that work with ODK. One of them is FormHub, also an open source. It will offer you a visualization. You can visualize it directly on the map, this data. And there's also Kobo, which is ODK based, but it offers many other tools. So this is how we're collecting now information from the field. There's no more paper. So again, how we disseminate information. Again, I'm going back to Julia to tell us a little bit about Rescue SMS, the system that they have set up here in Lebanon.
Sure. So initially, Rescue SMS was conceived of as a means to both reach a large population instantly with critical information, but also to have and facilitate two-way communication. So the hope was that either through a subscription service or through codes using IVR, we would be able to provide opportunities for refugees to give feedback on services and other interventions.
Okay, one one thing we're doing now with SMS. So in addition to disseminating information to the refugees, we're also using SMS. It's another way of communication for checking eligibility. So we are here in Lebanon, we are targeting 70% of the registered refugees with food assistance. One way that the refugees would text a number with the number, their case number, to a phone, dedicated phone number, and they get back an automated reply if they're eligible or not. So this will minimize the different calls to call centers or coming to the offices to check on eligibility and so on. This is one way of using a two-way SMS communication. At the same time also, they can change their phone number through an SMS. So they text the case number plus their new phone number, and this will change it in our registration database. So we're using also SMS in this way.
So just to highlight some of the, well, actually, before we talk about the challenges, I just want to highlight some of the positive impacts of mobile data collection. So Jad talked about efficiency with information sharing, also cost effectiveness and efficiency. If we can just go to the map. So previously, when we were using paper-based forms for protection monitoring, as Jad mentioned, it took quite a significant amount of time to share the data, to process it, and then to act. With the visualization and the mapping, we're able to immediately share that. And you can see here on this map that protection incidents are categorized, and this is available to UNHCR and all partners. So it actually assists with a rapid response. We're able to not only track protection incidents, but also referrals and follow-up.
Okay, I'm going to tell you, for those interested on the technical side, how we did this mapping. So the data goes from ODK to a Form Hub server with, say, IRC to another type. Some other agencies are using different systems. So in the end, all this data is structured in a similar way. So this data is sent on a weekly basis to UNHCR, and we're using CARTODB. CARTODB is a very easy to use, has a very easy to use API tool in which you can easily visualize this information and create search boxes and filters on the spot. So this one that you see, this tool, it was set up really quickly, and it can be set up in an emergency, the same system, really fast. So you want to tell us a little bit about this example in particular?
Sure. So in this location, the main protection concerns focus on documentation. So here we have unregistered birth, and this is a significant challenge in Lebanon. So with this information, we would be able to refer either directly to IRC legal staff to provide awareness raising and specific counseling on birth registration, or to refer to NRC. So this is just an example of how this would be actionable information as a part of the So some of the challenges associated with using technology. So around information dissemination, we initially began by using SMS, and as Jad mentioned, UNHCR will now also be using SMS. And so this is one channel. But what we learned as we launched the program and as we carried on is that we actually didn't really know what were the channels of information that refugees and host community members were accessing. And is the technology that we're choosing the best? Is it appropriate? So we did learn that people were actually switching phones and swapping phones and selling SIM cards. So it's quite critical to have a better understanding and a better grasp of how people are consuming information. One of the other challenges was with fragmented and dynamic service provision. And this is also a coordination issue. So the broader vision for SMS and a subscription service really required the capacity to know what services were available and to whom. And unfortunately, because of the fragmentation and the dynamic nature of service provision, it wasn't updated and it was very difficult to understand who was doing what where. Beyond the international community, very little mapping was being done on local service providers, government service providers, or NGO. So in order to have the full service picture, a significant amount of work needed to be done, and that information service couldn't be launched in an instant. Another coordination issue was that actually many different actors were using many different solutions. So there was a lack of coordination around how we were communicating and what tools we were using. So with multiple stakeholders using different tools, you lose potentially the efficacy of those tools. Some practical challenges that we face in the local market, in Lebanon in particular, it's a very challenging telecoms market. You cannot do reverse charge, so any telecommunication service, even an interactive voice response hotline, would charge the user, so whether that's a refugee or host community. Also registering SIM cards and even securing hardware in the local market was a tremendous challenge.
Yeah, I would like to emphasize on the coordination of tools. This is a very important point, and in the operation here, we're helping in the coordination unit. We're helping partners by setting up standard assessment forms and already building their ODK template and sharing it with everyone. The same way the protection monitoring have set up a standard set of questions and provided the tool, and the same with all other data collection tools. Okay, so lessons learned. Julia?
Sure. So just building off of the challenges that we faced, based on what we know, and not just in relation to the information dissemination and protection monitoring program in particular, but in general in this environment, the absence of communication strategies to inform how we were communicating with persons of concern from the outset were a tremendous challenge. And so we recognize that in order to improve response in the urban environment, it's critical that communication strategies are developed and tailored for urban response. Also, looking at context analysis. So context analysis, in order to ensure that we're reducing the amount of direct service delivery, that we're engaging with local populations, local service providers, and having context analysis that's inclusive of communication infrastructure and consumption habits. So what are those channels that people are using to receive information? With the service mapping, we wanted to be able to do community service mapping and use the mobile data collection, which had tremendous capacity to be able to update service information in real time. However, there's an emphasis on INGO service providers at the moment, and there isn't a standard approach that is inclusive for service mapping. So in the urban environment, standard tools for ongoing service mapping that can be updated and that's inclusive of local service providers is critical. And
yes, and going to using open source software and supporting them is a very important thing as well. Should we go into the innovation part? Okay. Okay, so I'm gonna just tell you a little bit about things that we're working on and things that have already been in place in an urban setting. So this is one system that we started, UNHCR started in Jordan in 2009, and we're still building on it. So what is the whole idea was, okay, we have a lot of refugees. Look at it, for example, in Lebanon. All of those refugees are in all these points here, okay? And the refugees, we have also not only a big number of refugees, we have large number of partners, implementing partners and operational partners delivering similar types of services. So, so how can we coordinate the delivery of service and the delivery of assistance for everyone? We said, why not have one database where we have all the beneficiaries or our beneficiaries on it? To start, we started. Okay, where's the biggest registration? Where is the biggest registration exercise happening for in a refugee context? It was with the UNHCR. We said, okay, let's put all this data together and make it available for implementing and operational partners. So what we did is that we built an online platform. We called it RISE, the Refugee Assistance Information System, which reads from all the registered refugee files. So all of the biodata and addresses and the information needed for assistance delivery is put in a place that is available for partners to use. So partners do not have to go and register again the refugees as they come to their offices. They just have to search for the file and deliver assistance. Okay, that's the idea. That's the idea. And that will give us much more accountability. We don't duplicate services. And we have a system where we can, a case management system where we can refer to each other. Okay, so this is a system that is in place. And now we're extending it and we're adding additional features. So basically, this is like a standard how you would see RISE. It's on the web, it's on the cloud, it has the files, and at each one of these partners, they can go in and then put in, I gave this family a mattress. Okay, if they go to the second partner, which could be in the same neighborhood or 2 neighborhoods away, they can see that agency A has provided a mattress, so they can provide something else, or if they're requesting a different service, they know which one of the other partners is delivering this service, so they can refer this case to them. So think of it, we have one case management for the whole response, for the whole refugees in urban areas. Okay, so an additional thing that we're building on top of RISE is linking ODK, this ODK mobile data collection tool, to the refugee files. So this is a new feature that we just released. It's in use now in Jordan, and it's going to start, we're starting to use it actually next week in Lebanon. So any agency, any partner could build their own form on ODK. They can go collect the data with their mobile phones and submit it. And all of this data goes straight, and it's linked to the refugee file. So imagine you're having in one place your cases, you're having the assistance records, eligibility records, everything, plus the assessments. So you don't need to go and collect this information more than once if you know that someone else has collected it. So this is to help reduce a little bit on the fatigue of access for collecting data and so on. So this is RISE. This is number one. The number 2 thing that we're working on is a web portal for refugees. You know, today I was looking, I said like, okay, there's 50 million displaced persons now in the whole world. Okay, I'm thinking if I'm one of them and I'm in a certain country and I want to access information, what do I do? You try it. Try to go and Google, how can I register my son? I'm a refugee somewhere. So it's very hard. This information is available somewhere, but it's very hard to access it. On the contrary, if you're a citizen of any government and you want to issue a passport or you want to issue a birth certificate, you can go and search for it, and you will easily find the form, find the procedure, and do it. So the whole idea is building. This started globally to build a web portal for refugees. It started with the innovation called help.unhcr.org, which is now in process. But in Lebanon in particular, we're building this web portal for the refugees. Okay, what does it mean, this web portal? It's a new communication channel with refugees. Okay, so what we will put in it, the same way we send an SMS informing something, we'll put the content there. This is the latest news and announcement. UNHCR will not register anymore on Saturday. That's an example. Another example, the school enrollment for 2014-2015 is starting. Please contact your closest, the closest agency. So you'll put it there. At the same time, you can put information campaigns on there. And it's very important to have this information downloadable. So if you put a video, make it available so that someone can download it and go offline and show it to the community. Again, it will have a section for questions and answers. So this is collected through all the sectors, questions and answers on how to access specific services, how to register, and it's searchable as well. Also, a mapping of the services on the same portal. So this is very important, to put the refugee as a client and try to make this information accessible. So even if we know that maybe 1% will access through web or through a mobile, or 2%, but there is also after this the word of mouth. At the same time, there's also the mobile app project that is ongoing in the region. This is a mobile application also for refugees. So basically the same things that will be on the web portal, plus some additional features like updating the contact addresses, or checking on eligibility, or maybe on the refugee status, and so on. At the same time, also the mobile app will have an assessment for the refugees. So basically, if someone would like to participate and provide information about needs, yes, why go and bother if we can collect this information straight from them and they can give it actually to us. That's for what's in the pipeline, and yes, specifically for an urban setting. I think that would be useful for an urban setting. So yeah, maybe now we open the floor for questions. I'm sorry we have been speaking for half an hour. We spoke 3 minutes more than what we should, but please, the floor is for you. Please ask any questions. You can raise your hand and we can give you the microphone. Okay, we have one. We're gonna give the microphone to Marco.
Oh, yeah. Can you hear me? Yes. Can you hear me? Hello.
Hello, Marco. We can hear you.
Okay. So thanks a lot for the presentation. I have but quick question. First of all, I'm in the Americas Bureau and I do cover North America and the Caribbean. And in the past, we also used the mobile devices for making a refugee census in the Dominican Republic, which was quite effective. Actually, it was DPSM who deployed a team, and they used a different technology, but basically, just wanted to mention this as an alternative also use of the mobile phones. I had a question on all these instruments that you presented. I think as an open source, this should come with no cost for the organization. But in terms of resources that are needed, I mean, human resources to create the initial tool tailored to the needs of the operation, and then maintaining, updating, for example, the service provider, if the service provider, for example, discontinue the services, and all of this, how much investment then the operation should consider, because then everybody can be equipped with the mobile phones and the tablets, but I think somebody should still be on the management side of it. So that was my question. Thanks.
Okay, thank you, Marco. Yes, it's a very good question. Yes, open source doesn't mean it's free, and there's always a cost. But if there is a general direction by all agencies, UN agencies, and NGOs to support open source software, this cost will reduce more and more in the future. So all these features that you request, that you might pay for on top of it being open source, it will become available. So if one, for example, I give an example of this great tool Activity Info that is being used to track achievements and indicators in the country. So it has been developed before, and now we chose to go for it here in Lebanon as well. And this tool, now we developed it so much, we actually used the same company that is developing it. We paid money, but the outcome, the result, is for everyone to use. So yes, there will always be costs with open source. There will be costs, but it's better than going for building the solution from scratch.
Sure. Just from IRC's perspective, I mean, with the minimal technology that we were using in this case, of course, we've been using also commodity tracking systems and other tools in other areas. But actually, of course, as you point out, the tools are open source. The cost of customization is not significant, and so we have been carrying out mobile data collection. We've been able to do the visualization, the mapping, and so on, and to develop some additional and customized tools. In Iraq, for example, we've customized an open source tool as an eviction early warning system, so using SMS, and this has been, with local staff. So those are, minimal fees for us. And now I just want to go to a question that we have in the comments box. So there's a question from Wale. Hi, Wale. Asking about the pre-crisis context analysis and in particular consumption habits. And so the question is, are we looking at host communities as well as refugee communities? And so I believe that's the question. So I'll speak to that, and then Jad, if you want to add anything. But absolutely. So I think this is, of course, in an urban response, refugees are living amongst the host population, so they're relying on the same service network, and that infrastructure and the capacity to deliver and access to services impacts both communities. And as you rightfully point out, those barriers are not necessarily unique to refugees. So documentation issues, discrimination, those barriers may also exist for the host population. Also, just to add that in terms of information dissemination, we also need to start thinking about host communities. So I know that we talk a lot about including the host community in urban responses, but that actually also goes to information on services, on rights, raising awareness around the humanitarian intervention. As we see in Lebanon, there are a lot of tensions in communities, and part of those tensions come from host communities not feeling informed. So I hope that answers your question.
We have another question, maybe also by Wale.
Wale.
So
that actually is the question I hope I answered. And then also from Aga or Andrea. So how to address confidentiality issues. So in relation to what specifically? So just if I could get clarity on the question, do you mean when, sharing data through some of the online platforms, or do you mean with data collection in general, so through protection monitoring?
Okay, in the meantime, there's a question, Chris Habib wants, I'm going to give you the microphone, Chris, to ask your question, and then we'll take one from the sound and one from the chat. Chris, over to you.
Yeah, hey, thanks, guys. First of all, thank you for a very informative presentation. I was thinking of something while actually listening to the questions and listening to what you've stated as tools, and I thought this statement is actually not a question. It's basically just a suggestion. But what if we have some sort of website at least to state those ICT open source tools, because I think most of the colleagues in the field and other operations would benefit from it. I'm not sure if there's a site that's already around, but I think that lots of operations have also similar tools which everybody can learn and benefit from and use at their operations. Thank you.
Thanks, Chris. I think, Jan, you want to respond to this too. I think that's a really important point. So, we all, I think, are fairly familiar with the challenges that we're describing, and we all understand, that we need new approaches, but it's really about operationalizing this. And so, and maybe, as you say, ensuring that we can bring together tools and make, the use of these tools, standardize it.
Yes, yes, that's a very good question, Chris, and we do have We do have several online resources that list those tools. One of them is the Information Management Toolkit that UNHCR has developed, which is basically a set of tools, not only links to open source, but also like simple tools for emergency, to be used in an emergency and stuff. I have to check if there's one specifically for listing the tools that are good in an urban setting. If everyone has this, if you can post it on the chat and share it with everyone. But I will post now the link to the Information Management Toolkit, which has a lot of resources, good resources and links.
We can also contribute to this tool, right?
Yes.
Okay. Thank you.
Thank you, Chris.
So we have a question from Colombia. How do you manage the role of gatekeepers, and do they pose a challenge to accessing the population? Also, were members of the host community included in monitoring needs and protection incidents? So on the first point, the management of gatekeepers. So for protection monitoring, we have a number of different entry points. So monitors are speaking with heads of municipalities. They are also speaking with other key informants as entry points into the community. But once they gain access to the community, they're also conducting a community-level discussion. So these are semi-structured interviews with the residents in any given location. Monitors are also revisiting those locations on a consistent basis. So we try to triangulate and to speak with a broad population. And as part of that, yes, we also speak with host community members. So we monitor both and address the needs of both. Also, we respond to the needs of both. As far as gatekeepers posing a challenge to accessing the population, yes, this can be a challenge, and I think some of the colleagues that are on this webinar from Lebanon may also wish to speak to that. But it can be difficult to access communities, in particular in an environment like a collective shelter. And this is an environment where there is management of that shelter that can be de facto, and it can be an individual who takes the lead. And so we simply try to address that through diplomacy, and then also through working with refugee and host community volunteers.
Okay. Let's see. Okay. We have a question from Haiti. Do you have a positive experience with IVR surveys? We tried this in Haiti for IDP feedback, and it was a complete failure. In UNHCR in Lebanon, we didn't use IVR except for like the simple ones to directly to the phone line. But maybe you can tell us about. Do you have anything? No.
So unfortunately we wanted to use IVR in Lebanon, but we weren't able to do that yet. So I don't have any good practice to share with you at the moment. So. Of course, if anyone else on the call would like to respond, and if anyone has experience with that, that would be great.
Okay, we have here from Connor, a graduate student in Jordan, conducting research on mobile phone usage of Syrian refugees. You were talking about reaching Syrian refugees in Lebanon through SMS technology or through a portal, but that assumes they can access their mobile or a computer. In your experience so far, what are the biggest challenges to Syrian refugees using their mobile? You spoke a bit about trust, but where do economic, educational, knowing about information, and poor mobile services challenges come in play? Okay, yes, in Lebanon, yes, of course, there is a big challenge, specifically in Lebanon, the cost of having a mobile phone. That's number one. It's unlike in Jordan that your line stays active for a long period of time. In Lebanon, it expires like soon after the month that you have paid for. That's number one. In terms of, let me just go back to the question. Okay, so again, regarding your question, if that that refugees can access mobile, we know that a lot of them will not have access to a mobile or a computer. But even if we reach a small number of the refugees, we hope that we know that the word of mouth also would help in this. So IRC is currently conducting a study about the usage of mobile phone, and the results will be shared soon. But it's about what, 5?
Well, actually, I think we should clarify first what we mean by mobile. So there's a difference between a smartphone and a basic, Nokia phone. So we know that only about 5% of the refugee population in Lebanon has a smartphone. So the app that Jad was talking about, that would really be accessible to that, let's call them a meaningful minority, because of course, as Jad said, the hope would be that they would be able to then be information disseminators in their community. Then there's a basic mobile phone that can receive and send basic SMS. And so we know that a significant portion of the refugee population has a mobile phone. Now, as I mentioned before, one of the challenges with this is that people swap mobile phones, they change, and there's potentially one SM or one mobile phone per family. So you have to be very cautious in the information that you're disseminating via that channel. I think what's really important to highlight is that none of these channels or modalities are meant to be a sole source of information. So, as we mentioned before, firstly understanding the context and how are people receiving information, and then designing a strategy in that manner. So not making assumptions basically about who has a mobile phone and who doesn't.
Yeah, and yes, the poor mobile service in Lebanon, it's not a big problem in terms of access, because the mobile phone, it's a small country and you have network all over, but the price is a big challenge. I hope we answered your question.
So just to come back to Andrea, the clarification. Sorry. So how do participants feel safe giving their information in case they don't want to be found? So that's an excellent question, and this is definitely a concern here in Lebanon. Sometimes people are concerned about sharing information, registering with UNHCR, and having their data shared. So in protection monitoring, it's a very simple approach, really. We talk to participants about what the purpose of the visit is. We let them know that their data is confidential, that it won't be shared, unless they give permission to share it for the purpose of referral. In terms of having participants feel safe, it's also generally about the approach to protection monitoring. So it's a community level approach, and it's a semi-structured dialogue. So it's not a survey. It's really sitting down, in someone's shelter, having tea and having a conversation. So that also creates an environment where people feel safe and where they feel they can share information.
Okay. We have another question from UNHCR Colombia. The exercise was for monitoring or profiling purposes? This is, I guess, about the protection monitoring.
Yeah. So, for the first question, protection monitoring is ongoing, and so the purpose is firstly to have an understanding of the protection environment, to be able to inform other humanitarian actors about needs on the ground. So it should be informing response and intervention. Protection monitoring is also used for advocacy purposes, so whether it's at the field level or over time, because the data is gathered. So we have mobile teams that go, out into the field on a weekly basis, doing visits 2 and 3 times a week. So over time, it's a really good analysis, or it gives you the opportunity to analyze protection trends to be able to identify urgent concerns and then to put together critical advocacy around that. In terms of where the mobile devices came from, they were procured on the local market, and they're much less expensive than any other device. So because we're able to immediately send that information up to the server, we don't need to employ a host of data management officers or reporting officers who would then require laptops to enter that and to manage the database. So yeah.
And on this in particular, in UNHCR and with our partners, we made a market research, and then we're using a cheap Samsung Galaxy Grand, which is we found it for a good price, and we put it as a recommendation in our we have a small data collection task force in which we recommended the use of this mobile in particular because it's cheap, and then we test on it our forms. But yes, for discounts, yes, we get discounts because we purchase locally, and when we purchase a quantity, we get a discount. And the UNHCR is exempt from taxes, so the price of the device is around a very good device is around $200, if not less.
So we have
there's one question about price from also UNHCR Colombia. They give access from the web portal for refugees to the RISE system only in one place. So in Egypt, they started using the RISE system, but in a different way. They only use it for refugees to log in and check on their refugee status. So if the result is out, or when is their next interview, and so on. So this is the only way the interaction between refugees themselves and RISE is in Egypt. In Lebanon, no, we're not using this. In Jordan, no, but yes, it's something that we're thinking about. Okay.
So a question from Eddie, DIP. Did you have difficulties in agreeing on a common intake template for protection monitoring? That's a great question. So for protection monitoring, ideally, if there are various partners that are doing it, the protection monitoring questions, the form, should be the same. Now, in the end, what was agreed upon because of specificities, regional specificities in Lebanon, was to have a common set of questions, core questions, that would be asked in every location in the same way. So it was fairly easy to come to consensus on it in that way. But it can be challenging, certainly, if you need to agree on an overall common tool. I'll let Jad answer the question about confidentiality and RISE.
Okay, RISE is inside RISE, sensitive information is really carefully handled. So we have permissions of read, write, and edit for every single section in RISE. So, and even the services that are inside RISE, the assistance tags, are whether tagged as confidential or not. So if it's assistance that is tagged as confidential, it will only be visible to within the same organization that has entered this information, and not for all the users in this organization, but only the users that have access to this exact confidential information. Also, from UNHCR registration system, only basic biodata and basic information basically is transferred. No RSD, no claims, nothing goes onto RISE. Only what is needed to deliver the assistance for these refugees.
Okay.
There's more up, down.
I just want to, because I think we've had a few questions from Colombia, but maybe just to respond to Daniela. So the question about sharing information for the purpose of a referral is different than sharing information, particularly in the case of CDD survivors. So it certainly is. So firstly, for protection monitoring teams, they would not actually do intake for survivors in the field. They would refer that automatically at the request of the survivor. So we only refer to the agency with the basic information, and those are password protected files. We also have SOPs for referrals for SGBV cases that are in place and that we follow. So also just in general, the systems that we showcase, so the mapping, etc., there are controls that you can put in place on who has access to what data. So actually, one of the benefits of mobile data collection versus paper is that there actually is greater data security. So you can lock people out of particular sections, and then you also don't have paper forms that are around and can possibly be accessed.
Okay.
So I think just to say we're coming up to 6 p.m. So I think we'll just take a few final questions.
Okay. I'll take Colombia again. Okay, so what is the interagency coordination model like in Lebanon? Are you implementing the new refugee coordination model? Does the humanitarian coordination architecture apply? If it were to apply, what is the role of OCHA in terms of information management? So the interagency coordination in Lebanon it's being led by UNHCR. We have the different sectors. The standard sectors that are all led by UNHCR and co-led by other agencies. For example, education is co-led with UNICEF, WASH, social cohesion and livelihood is co-led with UNDP. So that's how it is. We have an information management unit that is composed of, or a working group, if you want, that is following the same structure as the sectors. I don't know if I'll go more into detail. I'm not going to go into details into this, but we have basically an information manager for education is with UNICEF, the one on shelter is with UNHCR, and OCHA is part of this information management working group. And they are co-leading with us the assessment working group, which is under the information management working group. Okay, that's quickly how it is. Wow, lots of questions. You want to?
So I think we're going to take a final question from Luisa. And apologies, there were a lot of questions. So we can provide email contact if you want to follow up, and we can try to answer any of your additional questions at that time. So Luisa's question: there are concerns about the cost of SMS and the possibility to make arrangements with cell phone companies. Do we know about any work to address this issue? So that's a great question, Luisa, because as I mentioned, this is a significant challenge in Lebanon in particular, and it's also significant a cost in Lebanon. So I have not personally been involved in making agreements. So unfortunately, I can't give a very informed response to that. I do know that it's possible. Well, I can give an example. It's not around cost, but around being able to reach individuals that are using a range of different service providers. So in Iraq, for example, we were able to negotiate, I believe, what's called a bridge. And I apologize because I don't know if I'm using the right technical term. But this would mean that we could send out messages to Zain, to ICSL, and at the same cost. So I agree, it can be a significant barrier, and cost is a big consideration when looking at SMS. But that's my only experience. Dad, do you have anything?
Yes, cost is, yeah, there's a huge cost involved when SMS, especially in Lebanon, when you have 1 million. So each, there's a huge cost with each SMS campaign that we're trying to reach out. I mean, the more you send, the less the price of an SMS is, but it reaches the point that you cannot go lower. It's around like 1.2 cents per SMS. Another way to reach a big population, there's something called the cell broadcast. It's an SMS. It's also SMS based, but basically you target a certain location. So this, we are thinking of how we could use it, and if we are allowed to use it, because everyone in that area with a mobile phone will receive this message. But it's less costly, it's immediate, faster, and it reaches basically everyone. So in locations where we have maybe more refugees than local population, and know that that money, it could be an option, but of course there's a lot to think about before doing that.
Okay.
Okay.
So I think we should actually stop there. Jad's going to put his contact information into the chat box, and I will also add my email address. If you have further questions, please reach out to us, and we're happy to respond and to continue the discussion offline. So thank you very much for attending today's session.
Yeah. Thank you a lot. We'll be waiting for your questions. Thanks a lot for attending.